Hi, everyone. Welcome to Perspectives. We are your host. I'm Martina. This is,
Lyzeth.
yes, and welcome to Perspectives. I said that already, but anyway, we just want to make sure you know where you are. And this is Perspectives with Lyzeth and Martina. Um, so this is what our last, it's not our last video, but it's our last one for the series, Shattering the Veil, White Supremacy in Healthcare. So this is our like wrap up video recording that we're doing for this series. I personally think this has been a really good one. And I hope other people, if you're watching this and if you're listening, I hope you agree as well. So you should leave a comment. Even if you don't agree, you can say what you don't agree with. And let's talk about it. You know, we welcome comments, like, subscribe, do all that good stuff. It really does help us out. But yeah, we're just gonna spend the next little bit of time and wrap up this series. As I said, I think that this was a good one. We were able to get some even, we got really good guests to come on. People who actually in the fields, even though we are somewhat in healthcare as well, but people who are in the field, I think that was pretty good. I really do. Yeah.
I
So,
agree with you. I think this was one of the, interesting series that we've done so far. And I think just being able to have those sort of professional perspectives
yeah.
to give a glimpse into sort of even just the physician side of things and kind of seeing it and the impact that a lot of the systemic racism and things like that biases have played, and but also from the administrative side of things, which
Yeah.
you don't hear a lot of
I
people
really
really
think
talk
that was
about
eye
that.
opening. Yeah. You don't hear much because most patients just trying to get in and out. They don't know all the behind the scenes. It's fascinating.
Like I didn't know a lot, and
Mm-mm.
mind you, like I know I was part of an associate board for an FQHC,
Mhm.
and yet I mean, a lot of this information was just new to me because it's not. I think it's not something that it's something that an FQHC wants to share all the time, right? Like here are the problems, here are the challenges, here are the barriers, here's the things that happen behind the scene. Um, and I think it was just very eye opening to just to see that world from two very different perspectives, no pun
Yep.
intended. But just kind of seeing that and the glimpses that they were able to kind of thing, and even just when you think about the title "Shattering the Veil," like there were moments where I think, like for me, it was just really shattered. I was like, "Whoa!"
I
Like
know, like,
mind blown because
hmm
especially one of the things that comes to mind for me was when Carmen was talking about sort of the reimbursement of payment, and when you think about nurses and
I know.
FQHCs, and and I was like, wait, you don't get reimbursed? Like you actually have to pay them out of whatever grants or things that you kind of get, or however you get funds, like you have to pay them out of that because they're not considered whatever they're not considered to be like. I was like,
Fucked
that
up.
is so much. Like they're the people that are talking to the patient a lot of the times, and having those interactions, and
Yeah, engaging most with the patient.
yeah, that are and that check your blood pressure, that take sometimes they'll be the ones that take like all these things that your nurses do, and I'm like, wow. And just even I think medical assistants and all these things of individuals who don't aren't considered part of the team that should be reimbursed is mind blowing to me still.
That is very wild. And to think this is the 21st century. And just to think that, I mean, well, shit, we're here because there's a lot of shit that's not right in the 21st century. So, I mean, just add this to the ongoing list.
Yep.
But it is baffling to me because, like I said, nurses is really, when you get to a clinic or a hospital, wherever you're seeing your physician at, usually there's like a frontline person that's probably there, helping you get paperwork together. And then, you might have the MA that assists. You might have like another tech or, and then you might get to the nurse before you get to the doctor. That might be like the immediate step before you get to the physician. And to think that a lot of that time is not being reimbursed by insurances, that's sad. That's really, it's really sad. And it really, to me, just continues to just say how insurance is really just somewhat negatively leading healthcare in many ways. Um, because to me, that is, that is baffling to me that you pretty much, to me, insurance is saying, okay, your time is not valuable. We only value the doctor's time. That's it. So your time we don't care about. And that is fucked up. I'm just have to say it's fucked up. That is so messed up. I really, that is, I don't know. To me, it still, even though like I have listened to these videos again and written about them, just to even still hear that come out of my mouth, I still can't believe that we live in this sort of world, and we live, again, supposed to be in one of the most developed countries in the world.
It's not. In so many ways, it is not.
Yeah.
In healthcare, in a big way, it's not in healthcare. I think one of the things that came up to me when, after having that conversation and hearing Carmen kind of share about that, was really really look into the hierarchy of things, right? Like, who's considered more valuable, right?
Right.
See the physician, you see the surgeons being the ones that are more valuable. And you think about the time when maybe all these things started kind of being created, right? Because these are things that aren't that were they weren't created like 2 years ago or something.
Oh,
Like,
yeah.
these are things that have been in place for quite some time. And nursing has been, and I believe continues to be, a very woman dominated field.
Mm.
And you start kind of thinking like the role that plays in putting the value, right? Because we know women aren't seen
They're
in
not.
a lot of ways
Yeah, they're not
valuable,
valued. Yeah.
and then you start seeing more of like, even when you go into the medical assistants or the MAs, and who are the MAs, who
Yep.
is in there. And now I think, I don't know the numbers, I don't know, but I'm sure I know a lot of people in my circles that are MAs, and they're, women of color, they're people of color. And it's like, you have these kind of individuals, and you kind of just see the hierarchy of like who's valued and who's not. And the physicians will always be valued more for, do they go extensive, school and all these things, and they do all these things, but yet they their interaction with patients is so limited. And even more so when you get into the specialties, right? Like, when you start getting like, that's even more limited, your interaction. You always
Yep.
have physician assistants, and you have all these other individuals who kind of
Mhm.
get into it. And you start to wonder, like, where, I'm curious to, like, where in the hierarchy, when you start thinking more of like specialties and in hospitals, like, is it the same? Like, is it the same kind of hierarchy that happens as far as reimbursement and payment? Like, where does insurance kind of
Mhm.
dictate that? And I think it's awful that insurance get to dictate that.
It's, girl.
Like they get to dictate so much of what our healthcare is. And it doesn't allow, you know healthcare professionals to do what they do best, is to take care of people,
Mhm.
right? And get
Mhm.
them to their optimal health, because insurance creates so many barriers, whether it's reimbursement, whether it's covering the cost of things. um and they don't let the professionals do what they're supposed to do. And it's unfortunate, because insurance companies have create are part of the problem. Like,
Yeah,
I'll put out there, they're part of the problem. um
absolutely.
in that. There's a and then thinking back to Dr. Mejia's episode, I remember him saying, having some empathy for those that are in private practice, because they're just trying to operate in the system that they're in.
Yeah.
um and it's just unfortunate. I was like, they can't even do what they want to do, because I know, like, through my experiences, like, I know doctors want to help their patients, but
We hope.
they, but yeah, for the most part, I think.
Yeah, for the most part.
Um, but some of them can't to the extent that they want to because they hit a barrier. They hit an insurance barrier. They hit something that is like, I can't. And it's just, like that story I shared of like, for $150, they wouldn't see my dad.
Girl, for $150
For
from
something that
like years ago.
we
This ain't
didn't
even recent.
know,
Yeah.
like for something we didn't even know existed. We didn't even know it was there. Like it was just one of those things where it's like, and they're like, oh my gosh, for that they would have sent my dad home. Like if we weren't fortunate to have the funds to cover it, they would have sent him home and he wouldn't have been seen, and we would have wasted a whole other day, and we'd have to set up another, like all these things that are done. And how many people just give up and say, forget it, I will just skip going to the doctor because I can't go through all these hoops. Like it's just too much. I got kids to take care of. I got only, this was my one shot to go,
And
but I couldn't make it work, so I have to wait however long to go to this appointment again or whatever could happen.
here you talk about, the female dominance of the nursing field and the MA field, and like, oftentimes various technician fields too. It's like female dominant to a certain point, and then often, like you said, they're often women of color or people of color. And it's just, to me, it's like no matter what we do as women or as a woman who is of color, even a man who's of color, there's no like, you can't win. It's like, you're trying to go and better yourself and have a better life for yourself, and perhaps for your family, if you're supporting other people. um and it's just like, every time, you just, it's always, like you said, a barrier, it's a block to something. And the fact, that Carmen touched on too, about, in order to actually teach in nursing school, you have to have a PhD. um to me, that still was kind of mind-blowing to me. That, I mean, in some ways, it wasn't too shocking, but then it still is. And just the fact, I believe she did touch on that, because of this, this may not be representation,
Yeah.
which leads to not having slots for certain individuals. And it's just like, sometimes you can't win for losing. And just the fact that, to me, I just see it like people are really trying to better themselves and try to have a better life. And these sort of roadblocks that they run up against. And even from the standpoint of, Carmen, who is a chief operating officer, these are things that she knows. And even to a certain extent, she's sitting at a higher level. But there are those that are under her that are seeing this and has to go do this every day, of just having this feeling of being inadequate or not enough. And yeah, that's really kind of, what I drew from that. And it is. And just the fact that insurance plays such a big role in the American healthcare system. And, we talked about ACA. I mean, ACA was great for what it did, but also because when it came out, the administration, the Obama administration, didn't realize how uncoordinated healthcare is in this country. Which again is like, why didn't we know this? We got the data. We know it's not coordinated at all. But how do we end up here? Because insurance wanted to have a say in healthcare for other people. So it's like, sometimes it just feels like they're like, you literally can't, win. And it does get very discouraging. And, sometimes it's just really hard to kind of keep going. So I really applaud people who are like the boots on the ground and doing this day in and day out. Because this shit is tough. This is hard. And, I think I might have said it in one of the videos too, that you always hear like, oh, there's a shortage of nurses. There's a shortage of physicians. Well, why is that, Craig? I just made up that name. Like, why? Why is there a shortage? Like, what, and I don't know enough about that system to have more influence on that. But to me, it's just fascinating. Every time you turn around, you hear about nursing shortages, especially now because we are still in a pandemic. Um, and it's like, why is this still a thing? Why do we still, I mean, we know why, but why is this still a thing?
Yeah, as you were talking, like it made me think of something that I know I've said in the past of like, even though we can take 10 steps forward, we'll always be 10 steps behind.
Yeah.
And that's how I feel like the conversations that we've had kind of represent that, right? Like, yes, have we made progress? Have we taken strides forward? Yes, but we're always 10 steps behind because the systems were created to keep us behind, right? Like they're created. And I think when you look at, definitely when you think about, the hierarchy that we've been talking about, and sort of the nursing field, and you think about, you know the patriarchal systems, right? That those systems, those policies, those ways of thinking that continue to be there. And then you add in, the white supremacy into it, and then that plays a role in keeping women of color and just men of color, and just uh out of those kind of ways to move up. And then even a field like nursing. I remember Carmen saying, there's limited slots to even get into a nursing school because there's limited people that are able to teach nursing. So it's like, I think for, to be a college professor, I think you need a PhD, or you have to, like, for a lot of different,
So yeah, a
you
lot of
know,
them.
for a lot of them, I don't know all of them. I don't know much about that, but we do know, at least for nursing, and I know most in some other instances you have to have a PhD. And it's so hard, like, for if it's already hard for us as women of color, just black and brown individuals, to get into college, to
Into
even get a
college.
bachelor's degree, it's harder even to get a master's degree. And then when you kind of look into getting into that PhD, like, there's so much that just kind of keeps you. And it's not always the dollars that keep you away from it. Sometimes it's just not having people help you navigate it, and or
Yeah.
how to really get to where you want to be, and people that look like you, people that have had the experience and can,
Yep.
like, that's the bigger thing for me, is to is seeing that. And even if you had more individuals for teaching nursing, who will they be? Are they going to be more white men and white women, or are we going to see black women there, black men, Latinos, like, are we going to see them doing that so that they can start breaking down those biases and start breaking down that racism and those prejudices that exist in our healthcare system? I think that's also part of the discussion, right? To have That's why we need more people that look like us, because they can then speak on, like, I know one of the videos we talked about is, the thinking that, uh black individuals can withstand more pain. Like, that is false. But unfortunately, you might be a white person and I know you talked about those white medical students that were surveyed, um and said that, yeah, they believe that. And that
Mm-hmm.
was, like, not too long ago.
That was in 2016. I remember. I
Yeah,
remember
so
that
it's like, and
timeline.
it's like, if they're thinking that, and they're the ones that are getting into these, being able to educate future medical professionals, like, those biases continue to perpetuate, because you then don't have someone that looks like you, Martina, or me, or others, to say, like, that is false. We feel pain just like everybody
Just
else.
like everybody else, honey.
We're
Just like
not going to
everybody else.
continue perpetuating this. Like, this is false. It's been proven false. How do we ensure that that is? And that's part of that, having those systems not in place, those opportunities not in place to happen, because we have systemic racism and institutionalized racism. And
What the
you know
hell are they teaching? What the hell are they teaching in medical school? What?
no, but that is something we probably will explore in the
Yeah,
future.
yeah, because it's like this don't make any sense. In 2016, this is not that long ago that
Oh,
this happened, where we have white students who saying that they thought that their Black patients or Black people in general do not feel pain the same as white people. This is so ignorant. And I can't believe, and it's a lot of work to get into medical school. Okay. It is a lot of work to get into medical school, and it's a lot of work to stay in there and actually finish it. And the fact that these people got in, like, I'm like, have you always thought like this? Or is this something you learned in medical school? I'm just like really fascinated.
That's a great question.
That it is. And if you,
or somewhere along the line of this medical education that you're getting, did this come up somewhere?
Where did this come up? I mean, I need to go back and look at that more.
Did some
more
old
intensely.
white man tell you that?
Maybe so, because I just feel in 2016, this is what you're thinking as a medical doctor going out into the field. Like this, I was like, what the hell are they teaching? Or did you know this before? I don't know. It's just really mind-boggling about that, because there's no reason that should be a belief. I mean, 150 years ago, maybe, but not now. Like, I just not that close to like recent times. There's really, I don't get enough. I don't really see. I can't even talk because this is fascinating to me. But yeah, it's just, I feel like this should not be happening in the 21st century in our American medical school systems. And again, but like we always say, that's just another thing that needs overhaul too. It is, and I'm actually, I'm probably gonna look more into that, because I think that was at the University of Virginia. I need to double check that. I want to know, how did this topic even come up? Like, did somebody say something? Was this like, this got started somehow and made it all the way to being published? So this, I am going to investigate. But if anybody listening or watching have any insight or have additional links or videos or documentaries about this, I love documentaries. Lyzeth loves documentaries. Let us know, because this is really fascinating. That's all I can say about that. It's fascinating.
It's fascinating. It's frustrating in a lot of ways, because you're like, I can't believe we're still talking about this. We're still talking about how some might not feel pain. Like, no, at the end of the day, we're all human. Like, we all got the same.
Well, honey, we all got the same level of skin. Okay, we your level and my level of skin. We got the same number of layers.
It's just our shades are different. That's it.
The shades are different, but and again, this is why we have this channel. It's still, it's like, why is race still an issue? Race is still an issue. It's so much an issue that we have other countries and other parts of the world. They come here and people want to put them into a box. We have talked about that too. And I mean, people come here and they like, well, I'm just whatever. That's not how we identify. But don't get me wrong, there are certain countries that do have race issues. I'm not saying that, but it's just so evident here in the United States. And the fact that I hear people talk about, well, I don't see race. And well, y'all keep making it about race. But that's because y'all keep making it about race. Okay. I was getting ready to get heated. Go ahead.
Go ahead. If you got things to say, I don't want to cut you off.
No, I was just really like, that was a tangent, but it's all related to the healthcare. It's just amazing that
about race. It's played such a huge role in healthcare.
Yeah.
Who gets healthcare, and we talked about how, was it 1899? They were talking about how your social conditions also impact your health outcomes and not just your genetics. And here we are in 2022, still talking about it, still trying to fix it, figure out. But it's like, how are you going to fix something when you can't even change the policies and the systems that continue to perpetuate racism against Black communities and brown communities and any community that is not considered white into this European whiteness that continues to perpetuate our country and across the globe. essentially. And it's like, and we're still talking about it. Like,
Still
it
talking about it.
it plays such a huge role in a lot of systems, not just healthcare, but in a lot of other sectors. But I think because we're in healthcare, I think it it's really that, and it's unfortunate because healthcare is so important, right? Like, without our health, like, we can, our quality of life can be lessened, and this, and there's just so many things that impact it. And for us to still be talking about social conditions, which are now called social determinants of health, which is, your environment and your
Yeah.
education and access to healthcare, and nutrition and access to food, all those things that are considered, that impact your health and where you live and all those things. It's like, and to know that it is really based on your race or the color of your skin, or whatever biases white people have towards anybody that doesn't look like them, because it's there. Like, it's just part of it. Like, you can't get rid of it. If you, the optimal thing is being blue eyes, blonde hair, and fair skin, like, that's
Mm-hmm.
the epitome of what, is considered perfect. And like, oh my gosh, the optimist race, and like, what do you look like? And you even have hierarchy within whiteness, like blonde, blue eyes, fair skin. But if you deviate and have dark, dark hair, whether it's
Yeah,
black or brunette, like, there's even hierarchy within whiteness. Like,
it is, which is
that's
not talked about enough. I feel that is not talked about enough. The hierarchy in, I guess, girl. Do they have culture? I don't know. White people have culture.
you let viewers, listeners, y'all let us know. I don't know.
I don't know. Before I say white culture, I don't know.
Some
But
people say no, but some people say, I think they say like American.
maybe American white culture, because like I wouldn't consider like Irish culture white culture, because there are people who are Irish that are not fair skinned. So it's like, or I know people try to say, well, we have Irish blood or German. Yes, but we're not talking about ethnicity. That's we talking, yeah, talking about here. Yeah, that is. Yeah, that is. I would love to know about.
Maybe that's a future series. Maybe that's something.
American white culture. But to kind of talk about again like race and healthcare. I mean, even so much so, Black people and women, I think there are just certain ailments that are just tied to Black people, like diabetes, high cholesterol, high blood pressure, heart disease. I mean, also women. Women are like number one in heart disease too. I know you do know that. But it's like, but why is that though? Like, why are so many Black Americans, we are the highest in like all the comorbidities,
Yeah.
and people just, they want to say, well, it's the food you're eating. Please don't eat that cheeseburger. Don't eat those fries. You don't have that milkshake. Okay, yes. You know what? Maybe you shouldn't have 3 cheeseburgers in one day. Okay. But at the same time, it's also a product, like we said, it's a product of your environment. It's like, because I'm not saying that all Black people who have these comorbidities, and I'm not saying that all Black people who have them come from a neighborhood that you would associate that with. That's not, I don't want to put people in a box, but white supremacy does put people in a box. It does. But even like so much, like I said, it just feels like people just associate those illnesses with Black Americans.
Yeah.
And yeah, to me, it's just like, it's so much more than just that though. I really, like we're saying, we've been talking about social determinants of health for hundreds of years now. We didn't call it social determinants of health until fairly modern times, but this has been an issue. Where you live affects a lot of your outcomes in life, from health to education to housing, your financial status, it just all, the social economic statuses. And I think maybe healthcare is starting to really consider these others outside the 4 walls of a hospital, and really understanding the different social determinants of health, coordinating of care. That's the big one. I mean, I know Carmen spoke about, having how important it is to have someone who speaks the same languages as you. You might leave her facility and need to go to a specialist who don't speak your language. That's a social determinants of health problem. That's an issue. And so it's just really, it's just in the United States, we have really designated certain illnesses to certain groups of people. And I'm not talking about ethnicities, because there are certain ethnicities where certain diseases are more, or ailments are more prevalent. Just mean like around race.
I think one of the things that I was thinking as you were sharing was, sometimes, a lot of times, Black Americans were forced to live in certain areas, right? Like, you're forced to live here, you're forced to kind of only have access to certain things and not have access to everything. And I think that I mean, when you look at that and the history and where we're at today, that has played such a huge role in health, right? And what you have access to. And when you think about, when I think about like what's around me in walking distance, like there's a corner store where I can get some chips and some soda.
Yep.
Pop, because y'all were in the Midwest, it's pop, or Chicago, I don't know. And then
I'm from the South, we just say soda or Coke. Everything can be a Coke in the South.
It's true. I've heard that. It tripped me out. The first time I heard it, like, what flavored Coke you want? I was like,
Sprite.
I was like, I don't want a flavored, like, vanilla? Like, what are you talking about?
They're like, and they'll give you vanilla Coke and they'll be like, well, you should have said you wanted Sprite as your flavor. But that's okay. That's for another day.
Tangent. Y'all know.
Tangent.
On it. But like that's like there's fast food places and there's all these things that are around me, right? And so it's being that, and people say like, well, you can just move out. I was like, you got money to,
right? Do you want to pay for them to move out?
I was like, you got money for that? Like,
yeah.
Like, how is that gonna work out? Like, how do you just up and leave? And why should I have to move somewhere else to have the same access that others have access to?
Yeah.
Whether it's healthcare, whether it's looking at food, whether it's looking at the walkability of your neighborhood, right? Like, that plays a big role in health. Like, can I go outside and feel comfortable enough and safe enough to walk around? And safety is not always violence. Safety can sometimes just be that there's no cracks on the sidewalks. I'm not about to trip out here walking because people think
you live on a busy street. That might be something to watch out for.
Play because there's like it's a busy street.
Yeah.
Like, all these other factors that come into the safety, and unfortunately, a lot of times when you say safety, a lot of people think
straight to violence.
Violence, it's guns, it's the gang
violence. Oh Lord, especially if you're in Chicago. Like, we have other types of things that happen that are violent, unfortunately, that are not gang related. Okay, that doesn't involve guns.
There's so much, and I think it is regulated and it is impacted by the color of your skin and your race and ethnicity. Like, that's just the reality of things. And health, and that's healthcare as well. They even going in, say you go into a private practice and they look at you, they make an assumption of what you can afford, that you may not be able to afford this.
Yep.
You don't have the right insurance. Like, people make so many assumptions of what you walking in. And it is scary. Like, I know I am fortunate to have access to private practices and but it is always, I'm always looking for a doctor that looks like me.
Yeah.
Or that is just someone that isn't white. Like, and if it is white, it better be a woman, like.
Same. I'm like, now I have a few I can count probably on 4 fingers how many male white doctors I have, but the majority are women or they are of color. Yeah.
There's like, so there's that, because there is that sense of they'll understand a lot better. I'm going to, and I'm hoping that they create a much more welcoming environment when I step into their practice. Because I've gone to some other, other practices, and you don't feel welcome. You feel the
Just
the
eyes on you, just eyes watching you.
instant judgment of like,
Yeah.
she might not be able, like, I wonder what kind, like, you can just tell they're asking like what kind of insurance she has. I wonder if she
Can you afford to be here?
and it's like, because I work downtown, a lot of the times I'll find my doctors downtown because it's just easier for me to like go and there is still that sort of judgment in people's eyes when you walk into sort of a place and a healthcare place, and it's like, and then you show them your insurance. I'm like, oh, okay, yeah, you can.
Yeah, no, it's all dandy then.
Then it's like, well, yes, let's run
Please
all the
come here. Give us your money.
let's run all of the tests that you want.
Yes.
But it's so, but again, race plays such a huge role into it, and biases and prejudices and racism has played such a huge role in care that it's sad. It's just sad. And the fact that, I it also plays a huge role into why we don't even have universal health care.
Oh, absolutely. Yes.
Like a huge thing is race. It's racism. Like, for me, it's racism. Like, y'all are racist because y'all be saying that universal, like, it's not about that we can't afford it. It's like, it's because you're gonna pay out of pocket for people that don't look like you. That you feel that you're paying, like your taxes are going towards people that don't look like you, and they don't deserve it. Like, nobody deserves it. They should, pull themselves from their own bootstraps. We hate that phrase.
I hate it.
But that's the sentiment that a lot of people think, and I think if this was a completely just like a white country, they would have had universal health care.
Yeah, that is a good point. That is such a good point. And it just, well, it makes me, I always say the federal government, at least at that level, they do what they want to whom they want when they get ready. So, yes, would universal health care be something that's difficult to do? It might be, but is it worth doing? Yes, it is. But that's not how the ACA is set up. And it's like, hey, but when the United States wants to go over here and take all this oil from countries that we don't hear about, but we know that they do, or they put kids in cages, they make that happen, and they know about that. But you can't give people universal health care. And, I've talked about this before where I think, just hearing you talk about, in your neighborhood, you have like the corner store, you go get you some chips, you go get a soda, you might have, I don't know, one of these fast food places. But where's the grocery store? It's probably 20 minutes away, 30 minutes away. You got to catch maybe 2-3 buses to get there. Ain't no Uber because that's kind of expensive. And that's if Uber comes to that area. Not saying that they don't, but they may not. And this is not your area. I'm just saying in general. But it just like, it just really make me think that this country at times just doesn't care about all its citizens. No, I think that's very evident. But it's just literally, it is about race, because why can't we get universal health care? Or at least something equivalent to that. Hey, if you don't want to call it universal health care, because I think that name freaks people out. I think it might freak folk out. They really do.
Access to all. I don't know what you want to call it.
I don't know what the fuck you want to call it. Call it something else, but let it give health care to all people. Because, Dr. Mejia talked about this in either his first or second video. There's a privilege that you and I have because we do have pretty good insurance, and we can go through that selection process and pick, like, you can pick a Latina gynecologist, I can pick a Black dermatologist. We have that privilege to be able to do that, whereas sometimes people don't have that privilege, especially because of the communities they live in. They have to just go to who's available. And that's if they can get in, because there might be a wait list, because you probably got one or two doctors at like a small clinic trying to see everybody, and they can't get everybody in. I mean, the same thing goes with dentistry, therapy, all of it. There's free clinics or free services out there, of course, yeah. And some of the really good ones, they are able to get past wait lists because they are very streamlined and things are very just done really well. So there are those out there. But for the most part, it takes a lot of resources. As we heard Carmen talk about, it's a lot of resources that goes into a clinic, especially one if you have a sliding scale or if you're free. There's just a lot of different resources, and it brings you back to healthcare being a business. Like, this clinic got to be able to function. They got to be able to pay their staff, and it's almost like it comes full circle.
Really does. I mean, I think that healthcare as a business sort of conversation that we had really with both Dr. Mejia and Carmen in sort of different levels, but just the fact that is a thing and it's a reality, right? That you have to find ways to ensure that you see enough patients so that you're going to get reimbursed to cover the cost of your operating costs. So what does that mean? You're going to see them for shorter amount of time, like that 15-minute window. And it's so true. And I think it even trickles into private practice, because I know
it does, yeah.
like they want to see as many patients, so of course they over book, like
Yeah.
you have, and then you're there waiting sometimes. Like, I know I've gone where I'm waiting and it's like, y'all, I made a 7 a.m. appointment for a reason. Like,
So I can get in and out. Why am I here at 10?
and you're waiting, and then you kind of go and you see the nurse or the MA, and then you speak to the physician maybe for like 10 minutes, and now you see a lot more what are they, registered nurse, oh my gosh.
So you talk about nurses aides, or we talking about
Nurse's aide, a nurse practitioner.
Oh yeah, nurse practitioner. Yeah.
Yeah, I was like, they're kind of like, they can prescribe and do all these things. You see a lot more nurse practitioners.
Oh yeah.
More so than you actually see your physician, which is just like another conversation for another day, probably.
That is such another. You know what? Because that's so true. It's like, and don't get me wrong, I've had a few PAs, but it's just almost like, but I'm coming here to see the doctor though. Like, you cool, I like you,
Yeah.
but I'm coming here to see the doctor, particularly the MD, for a reason. And I have to meet with you. Okay, cool. But like, why is the doctor so busy that they can't see me? Or I can't get in to see them. So they got to create a whole field of physician assistant. I remember a few years ago, that was such a hot, lucrative career. I don't know if it still is now, but I remember when I was hearing about it. I might have been an undergrad. And now I know a few friends who wanted to go that route because it was like they could make really good, they make good money. And it was just a very lucrative field to go into. But it is so true. Like, there are so many physician assistants, but what about the time with the doctor? It's not there.
And sometimes when you call, they're like, oh, you're gonna see the nurse practitioner, and
Yeah.
and I'm like, oh my, that's fine. Like, all right.
Yeah.
And but side note, and not too much of a tangent, I was watching a documentary, as I typically do.
It was at the documentary. I can't even talk right now. A documentary or TikTok. I knew it was going to be one of those two.
It's always going to be one of those two. And they were talking about how nurse practitioners, that we would have like much more access to like healthcare if they would allow them to open their own practices, but because they don't get reimbursed through insurance, and I guess they get reimbursed or paid through like the physician or something like that, like I don't remember exactly, they have to like work within like a a practice, but they can't open their own because they're not reimbursed. As we know, nurses aren't reimbursed through insurance and all these things. Like they can't get reimbursed. And I was like, that is dumb.
That is the first, I did not know that. I always thought that physician assistants can't operate on their own because, oh shit. It really, I lost that train of thought. I didn't know it had anything to do with insurance. I thought it because like they couldn't operate outside of an MD. They had to be with paired with an MD. I had no idea until now. I think that light bulb went off. That
like their reimbursement, for like whatever is tied to the doctor, the MD, like some like that's what I was.
Lies have been told. Lies. I did not know that.
After I saw like this snip, because I didn't watch the whole thing, but I saw this snippet and I got mad and I turned it off because I always get mad and I turn off documentaries because then I'm yelling at the TV.
I did the same.
But I was like, that's something that I definitely want to research more. If you're listening or know about that or know any NPs, like
are you one yourself?
If you're one, like let us know if that's the reality. How does that work? Because I was very surprised to hear that. Because I was like, because they're like, we would have much more, more access. They're like, are there limitations to it at MP? Yes, but they can do a lot more than just, they'd be able to open their own price. But that one of them had mentioned like, I can't because I'm not in the reimbursement system, so I can't go and open my own practice.
No. That's a shame. That's all. The lies we have been, and some of these are lies, outright lies that people have been told about different things and how systems work. But again, it's because I think, and I think Carmen said it at the end of her last video, ask the questions. You are the patient and you have a lot of rights, more rights than I think any of us know at times. And ask those questions and understand, like, for some people that, might come easier than others. But, if you don't feel right about something, or you have a question about why does this cost $62 when my insurance is supposed to cover this at 100%, some people just flat out pay it because, they don't want to go through the hassle. But ask those questions, like dig into this, because nine times out of 10, you're probably right. And the insurance is just wrong. They wrong.
Next time I go to the doctor and I see and they schedule with the nurse practitioner, I'm gonna ask that question.
And report out.
Is this a requirement? Is this like, could you open up your own practice if you had the ability to get reimbursed? Like, is this a thing, or was that documentary lying to me too? Like, who's lying to me?
Who's the liar here? Because that's really some bullshit. Because if you got to be connected to I knew that they had to be connected to the MD, which is, I thought that was like, I don't know what I thought. Just thought they just had to be connected to a medical doctor because they're not a medical doctor. But it's just like, I wonder, like, how do they even get paid? So it's like, that's, to me now, that's fascinating, because if you got to go through the insurance, but then like you can't get reimbursed. See, now it's like a whole can of worms.
Be reimbursed, but the reimbursement comes under the MD. So
it comes under the doctor.
Yeah.
Okay. I don't like that either. I don't want anybody handing me my money. Let me cut my own check. I don't like that.
Like, oh, we'll pay you, but we got to give the money to your parents first, and then
right. Like, spend all this time in school, all those nights studying. Yeah, no, give me my money. Like, that is crazy. You gotta go under, like you said, like your parent to issue your money out.
Well, next time
I want to know.
I'm gonna ask, because I am curious, and we'll come back and close this loop for sure.
Yeah.
We're definitely gonna explore healthcare more in the future. This is not the last.
Oh, definitely not.
Because there's so many facets to healthcare that we can talk about, and not just health disparities and the impact of race, but just so many things that kind of go into healthcare that that are impacted by racism and things like that, and what it looks like. But so we'll come back And if we happen to forget, y'all just let us know. Just
Yeah, let us know. Like, if there's anything in particular, because like you said, Lisette, there's just, I mean, healthcare, medicine, there's a lot, and even science is connected to this. So it's a lot that we still haven't talked about. We really just the tip of the iceberg around all of this healthcare and medicine and science. So it's definitely going to be a continued conversations. Yeah. But anything particular anybody wants to hear or have insight on, yeah, let us know. Find us, DM us, comment on this video, or comment on the podcast you're listening. Because yeah, there is just so much out there, and we're not professionals in those fields. We're going based off. We have wonderful guests who are able to come on and talk about this, and based on our own research that we do, a little bit of documentaries and TikTok and Google.
Feel free to correct us.
Yes, that we do. But yeah, we don't work in all these professions, and there's just a lot out there. So definitely welcome people's experiences and interests. So bring it.
So as we're kind of winding down in this episode, um, what are some final thoughts from this series, Martina, from your end? Like,
Oh Lord, let me cross my legs. Wait a minute. Oh my goodness.
how would you sort of wrap this up from your perspective?
From my perspective, I think we've been very fortunate and very blessed to have two really good guests come on to give us their time to really, again, like get into the nitty gritty of it. And, we had Dr. Mejia talk about his journey all the way from Colombia to come to Chicago, and just pulling up his whole family and coming here and not speaking a lick of English. And look at him now and really hearing his optimism. That's the thing about Dr. Mejia. He's just a wonderful person in general. And when I listen to his optimism in those videos, it really does give hope. Because I think we have this platform and we're using it to talk about these issues, but it can be a lot. It can be really heavy to hear, and it can feel hopeless, like we've said. But we do got people out here who want change. We just got to figure out how we're gonna get there. It doesn't all fall onto one person. This is a collective thing, and it's gonna take time. It's taken a long time to get to where we're at with these issues. And I think really, yeah, to have Carmen come on too. I think Carmen really just was mind blowing to me. Just like I said, to hear like all the background and the behind the scenes that you don't know that happens day to day in a clinic, or what goes into electronic medical records and things like that are very interesting and that could be very pertinent to your health. And yeah, I think again, I just stated it not too long ago, but just to be curious. And Lisette, I think you said this too, just in general, like in the United States, we don't ask a lot of our government. We really don't ask a lot. We don't expect too much, and that's really sad. And I just think, we have to keep pushing the envelope and pushing the button, because healthcare is too big of an issue. This is not a small, easy fix. It's not a simple matter. This is people's health. This is life and death, birth. So I just, we just got to get it right. And it's going to take time, but we got to get it right. So that's all I'm gonna say about that.
Yeah, I think. Yeah, I know. I've mentioned that we don't expect much from our government. We don't hold our government accountable as much as we hold like our nonprofit organizations accountable. That's always been something. If you watched our nonprofit series, you'll understand that we go into that a lot in that series. About how we as just community, as residents of this country, citizens of this country, people who live here, like we don't expect much, and we don't expect much because we've never have been given much or been provided much from our government. Like that's just the
Or you
honest
feel
truth.
like it's like something that, and I don't mean to cut you off, but feel like they're just doing it to say they did it. Like they don't
Yeah,
really care.
yeah,
Yeah.
but I think it plays into how they continue to operate, and and it plays into how it benefits a small portion of our country. So yeah, I didn't mean to go on a tangent on that, but you just brought it up and it just made me think of like we definitely, but in things like healthcare, you know, I think it's important for us to remember that we do have a say in things. We do
Mm-hmm.
have the ability to kind of come together and demand more from our government, demand more from these systems that continue to uh, regulate our healthcare, continue to regulate who has access to healthcare.
Mm-hmm.
Because it's not just the amounts that we pay, like the access to it, and the ability, and I think about pharmacy, like our medicine, and all those things that come into healthcare, what we have access to, and the cost of it, all these things that um we shouldn't have to worry about, right?
Mm-hmm.
Like you shouldn't be diagnosed with some life altering illness and have to think about how you may lose your house.
Exactly.
Like that should not cross your mind. Like you should be like, all right, I'm gonna fight this and I'm gonna win this fight, and we're gonna, whatever it is, and we're gonna go through it, and everything will be okay. Like the financial piece is not, and you have places like St. Jude that are able to help kids and their families, but that's not the norm, right? Like we all should have that support for whatever diagnosis we have, like, and not be afraid, because I know we talked about that with Dr. Mejia. Like you can go bankrupt if you are unfortunately are diagnosed with some illness that's going to require treatments and all these things. And I think that's a lot of what I think about, like, um what can we do to change that, like what can be done. And I think um it's definitely that starting the grassroots level, starting at the community level, like doing things at that level, but also demanding from our government, from these systems, to change things, to demand universal healthcare, to demand access for all of us to do it, regardless of your status, regardless of your immigration status, regardless, like
Never.
people should be taken care of,
Never.
and we have the financial means to do it. Like it's a 100% of a lie if anybody tells me like, oh, it's just gonna cost us so much. I was like, y'all have spent billions of dollars in bailing companies
Girl, I
out.
was just about to say what you said.
Just throughout history, we see our government stepping up and bailing things out and giving money and all these things. And I'm not going to get into the military. That's a whole other conversation. But dollars have been spent there, and we can get into it in a different episode
Mm-hmm.
and do that. But it's just, but the things that are really going to impact and improve the lives of the people who live in this country,
I'm not investing in it.
we don't invest it in. Our government, our federal government, our state governments, none of our governments, local governments don't want to invest, into it, and they expect someone else to do it.
Right.
And that's the whole thing. And I think, that's just my thinking and sort of like what I've kind of learned. And um um I want to take Dr. Mejia's positivity
Yeah.
and his hopefulness, and I'm gonna try.
I know I'm gonna try. I'm gonna
I'm
try.
gonna
It get hard.
try,
We get
but
to-
I also don't want to lose this the sort of the questioning and sort of saying like, no, like I definitely think we can, to your point, Matilda, you said like we can demand more from every level of government to do something about this.
Mhm.
um and and it's gonna take people coming together, like our communities coming together, and definitely like our black and brown and red, yellow,
All of us.
all of us to really say like, if this is important, if we're tired of seeing our families going bankrupt, losing money, not getting the care that they need, um, and and all of that, like I think we need to come together and figure out a way to really demand this and have that. And y'all, it's election years and all those things, they all play, like midterm elections play such a big role in that. So
So get out and vote.
go out and
Whenever it's
vote,
time to vote, vote.
because
Yes.
midterm elections are much more important than your presidential elections, people.
And we
Please.
see who has been in like presidency in this country. So
Like your midterm elections are much more important than you think. Or maybe we'll do a series on that. We'll do a
we
series
should or
on
go live or something, like during
definitely,
like election time.
and then
Yeah.
we'll talk about why it's important.
Yeah.
Let us know if you'd like to see something like about around uh, midterm elections or just elections in general. Let us know. Either find us on Instagram. We have a Facebook page as well that you can reach us, DM us, or just comment if you're on YouTube. You can definitely comment as well on that. But that's sort of what I think around that. And I'm looking forward to kind of continuing our conversations in the future on healthcare um, and doing that. But I think we'll close out our conversation today. Thank you for sticking with us on the series, Shattering the Veil.
Yes. We still
Kudos to
got some shattering to do.
kudos to Martina for that great title, Shattering
I
the
really
Veil.
did think I must say that was a good title, man.
Kudos to you, Martina, for sure. It really just put like this image in my head, like of glass shattering. Have you seen
And
that?
it's hard to come up with good titles. Anybody who's out here doing this, creating content, we've learned as we've done it. It's not easy. It's definitely hard. And we're still kind of early in the game, but yeah, it is definitely a hard road to hoe. It's a hard road to hoe, but we love it. That's why we're here. So
Over here. But if you have any questions or recommendations, like I said, feel free to contact us. We're looking forward to bringing you other episodes and other series as well in the future. But make sure that you subscribe to our YouTube channel if you're on YouTube. Make sure you like us on Facebook and Instagram. Follow us as well. And make sure you rate our podcasts.
yeah,
We'd love for other people to hear and learn, especially when we have these awesome guest speakers who share so much of their knowledge and things like that. But this has been great.
Yes, it has. So thanks again, everybody tuning in.
So enjoy, and we will see you soon or talk to you soon.
Bye-bye.
Bye.